Hi, and welcome to another video presentation on cognitive assessment. I've been talking about the particular problem surrounding validity in neuropsychological tests that mostly assess skills into the deficit or impaired range. The usual statistics don't easily apply, and it's easy to have a false sense of validity because of the large anchor point in the severely disabled patient population. The question of validity, for me, transitions into meaningful clinical utility. Do I find the test useful in my day-to-day assessments? If not, I do not have time for it. When I started out my first neuropsychology laboratory, I used the modified Halstead-Raytan approach that I learned in Wisconsin. I quickly found that many of the components were not useful. The extended lateral dominance scale gave me little meaningful information about brain functioning. The aphasia screening test was too brief to even give me an adequate appreciation of an acquired language disorder. Speech sounds perception was generally insensitive, and the seashore rhythm test was largely a test of sustained attention. Sensory functions testing, for me, went beyond what I needed to evaluate. And I also stopped using a number of the Wechsler subtests, again because I didn't find that they contributed to my clinical evaluation. When we look to clinical utility, we're simply saying, does this help me in my assessments? I want to turn to the test I've been most closely involved with, Cognistat, because I believe this test, while not sophisticated statistically, gives tremendous clinical utility to those who use it. There's only limited meaning to the standardization data in Cognistat, and reliability is hard to talk about in a deficit measurement test. The results of its subtests are largely categorical rather than numerical, and yet it's helpful across a broad spectrum. Geriatric treatment centers and alcohol treatment programs have found it very useful. Occupational therapy has used this test heavily over the years. Studies have shown how well it works in traumatic brain injury, and it has proven to be an excellent dementia screening test. I'm pleased to say that after 35 years, Cognistat has established clinical utility on many fronts. Next time, I'll talk about reliability. Thank you.